Thanks everyone for coming out, and thank you to Hint for putting on a beautiful conference. It's tough to be a venue surrounded by water on three sides. Today we have a great panel lined up on the technology and the innovations that are making the biggest impact on direct primary care. And everyone that's joining me on stage today is a physician and also an executive at a company building the tools to help other physicians deliver better care for patients. Joining me today is Dr. Maha from Fold Health, Dr. Michael Docktor from Dock Health, and Dr. Sara Pastoor from Elation Health. So instead of guessing at some of the biggest trends and kind of taking it from there, why don't I just ask the experts, what are the biggest either technological trends, innovations that you feel are making the biggest impact currently on primary care? Why don't we kick things off with Sarah?
Is this on? Okay. We're just going to jump right into AI.
It is 2023.
Yeah, I mean, I think we haven't seen anything impact primary care like AI ever. I'm talking to doctors who are saying that they're saving 16 hours a week in documentation time just using an AI scribe. And so there are a lot of other trends to talk about, but that to me has been the most impactful one. Talking to physicians who were on the verge of losing their jobs or just having failure to thrive because they were so overwhelmed with all of the documentation burden. And this really has rescued them. So I'm excited about, there's so many things that AI can do, and we can talk more about that later, but just the AI scribing has been a game changer. And I think, if you fast forward 5 years or so, we're going to look back on the days when doctors sat at a computer and typed their notes like we were living in the Stone Age.
It's hard to not double-click on that comment, but I'll leave that be for now. I think for us, and a little bit self-serving, seeing practices, use tools, and to Nancy's earlier point, the ability of tools to help, create process and structure. We are a task management platform, so we help practices and organizations get their act together, so to speak, and AI will hopefully power that more and more, but I think, systems interoperably working together, interconnectedly working together and providing the structure and process is what we're seeing is really changing the game for folks.
I'm sure some of you saw the news story about a woman who had taken her child to 15 different physicians. No one could figure out what was wrong with the child. And then she put the symptoms in the ChatGPT, and it figured out what was wrong. And I think, that's a great case story, but we all went to medical school and learned our trade, our craft for a reason, because there are a lot of elements that you're not going to pick up, that a ChatGPT is not going to pick up, that we have to subtly take into account when we're trying to figure out what's wrong with someone. And I don't think we want to lose our autonomy. So the way I see AI integrating into our practices in the future is as an adjunct to help us, as opposed to a replacement to replace us. And we're already at Fold Health, we're already leveraging it today to do things that are like mundane, like develop an email to go to your patients to tell them that you're going to be gone for Labor Day. That can be done with ChatGPT. Discharge instructions, other tasks that would take time away from you and your patients, but now can be outsourced to something like AI.
And what do you think that some of the biggest pain points are that providers are facing and that AI or task management software might be able to help address? The solutions that you're currently building, is there any pain points that you commonly hear from the providers that you're working with, and how are you helping tackle those?
Yeah, like I was saying, if you have to do something that, ordinarily we all sit at the computer and we have to type out an email to our patients to tell them something, and we sit there and we get writer's block. You just pop something in and it can be done as soon as that. I'll tell you a great one I had. I had a patient who had atypical chest pain, and I was searching my EHR for discharge instructions on atypical chest pain, couldn't find it. popped it into ChatGPT. It gave me something that I could edit down to what I wanted, add my own details, and there it was. And so time saving, helping with communication, I think there's a lot of ways we can leverage it. We're just kind of scratching the surface. So I don't see it as something threatening. I see it as something that's going to augment my practice.
I think what we're seeing and we're hearing as we sort of deploy to more and more practices, just the challenge of finding good people to help, the practice run, the administrative folks, and giving them the power, whether it's through ChatGPT or through the right administrative tool sets to get the job done, right? So most of healthcare operates on Excel files and email and Post-it notes, and that's sort of like the incumbent systems that we're all used to in healthcare, and maybe a little bit of the inbox within the EHR, and that's really not building the system of accountability and process and structure. And so what we're helping organizations as they struggle with is that just onboarding of their patients and just the mundane routine stuff that, again, ChatGPT is going to help augment, but it's putting structure, process, accountability around those things that are hopefully super common, onboarding of a new patient, managing referrals. These are things that really don't belong in Excel files and Post-it notes. And so, again, keeping your staff happy, keeping them accountable, keeping everyone efficient, providing the best care to your patients, that's fundamentally why we started this company. And that's sort of the pain that we're seeing, at the Rockface, and trying to help with that.
Yeah, plus one to all of that. We talk a lot about admin burden in primary care, and I know it feels like it's less of a burden in the DPC practice, and certainly there is some stuff that we get rid of when we walk away from the insurance world. But I think there's still plenty of admin burden to go around. It might not be stressing us out as much, because we have fewer patients and all the things that we know, the good things, we're not hassling with insurance companies, et cetera. But I still think that there's a lot of administrivia that we can shave off through technology, that anytime that a workflow doesn't feel intuitive and you can't figure out, how do I get this thing done? Anytime you have to have too many clicks or too many keystrokes, anytime you're doing duplicative work, anytime you're having to toggle between different systems because things don't integrate well, all of those things just create more hassle factor, extra work that's unnecessary. So to the extent that we can make things, that we can automate things, that it's just happening naturally in the background, you don't have to think about it, to the extent that we can minimize the amount of effort that goes into getting a thing done, whether that is collaborating with other team members or ordering a referral or reviewing lab work or talking to a patient, whatever it is, all of those things need to be as automated as possible and as efficient as possible, so it just feels easy. We want it to be easy.
It sounds like a lot of these pain points are kind of stem from the administrative side, the admin burden, the operational aspects of running a direct primary care clinic that maybe medical school curriculums aren't really preparing physicians for. Where do you feel that there's gaps on training people for the operational side, and how can we fill those care gaps?
I think the DPC community does a great job of this, just by providing that sense of community and teaching each other what their hacks are, what their go-to solutions are, and so we learn a lot from each other in this community. It's true, you really don't learn this in medical school or in residency, and so the gaps are everywhere, and to the extent that you can use technology to make those things happen for you without having to figure out, if I had a staff member that knew how to do this kind of stuff, this business of medicine stuff, then, but so we want to make that as easy as possible in the background. But a lot of it is just like we teach each other, I think is the best way I've seen it done. And of course, there's lots of resources out there from different companies and programs that help. Lauren Tancredi's here. She's great for helping people learn how to do that.
Yeah, this is like my own little soapbox. That 20 years ago, when I went through med school, there was zero financial literacy. There was, my kids are now taking these classes in high school, which is amazing. I think there's just a real lack of understanding of how to run an organization. I'm a first-time founder. I'm kind of figuring it out as we fly the plane. But it's amazing that this group has a community, and I would certainly suggest leaning on each other. I mean, this is, if you think about the tech adoption curve, this is a super innovative, early adopter group, and so you have the benefit and access to a hall of, great vendors that are hopefully value-added services that can make you run more operationally efficient. I would implore folks, the difference that we see between a really successful organization and one that, is perhaps flailing operationally, is just having that leadership and having that sort of mandate from on high that says, hey guys, we have to provide this level of service for our patients. We have to provide this level of care and love for the people that are on our team, our caregivers, our team. So I think it does start at the top. So for those who are running your own practices here, I think it's incumbent upon you all to work together and find the best tools to empower your team to work more efficiently, productively, to provide the best care for your patients. And again, that's not stuff you learn in med school. It's stuff you learn on the fly in the real world. So, lots of resources to tap into.
Yeah, I know for a lot of you may have made a transition from being an employee and just being a physician to now being a business owner, and that's a huge deal. You've got the medical part, but what about everything else? There's so many, to be successful in a modern era practice, there are things like marketing and campaigns, lead capture, right? Leads and capturing leads. Organizational management in terms of understanding the efficiencies within your own practice, how the practice is running, and then tweaking it. Analyzing claims data, or if you're working with an employer, providing them a report about how their patients are being cared for, how you're saving them money. So there's a whole host of things that you have to do beyond medicine to be successful as a physician entrepreneur in this space. And I think, as Dr. Docktor was alluding to, there's a lot of products like ours that understand that and want to make those tools available so you can be successful.
Can you maybe give the audience a bit of a background on what Fold Health does and how these trends kind of impact your day-to-day operations, how you're helping these physicians solve all of these problems?
Yeah, the legacy systems were built for traditional fee-for-service, right? Many of us grew up in that fee-for-service system. And so all of the tools were really centered around the physician and what the physician did with the patient and billing and coding. And what we realize is in primary care, 80% of what happens to the patient happens outside of that office visit. And yet all those people that are involved don't have a seat at the table in traditional systems. And so what we've really had to do is, if we're focusing more on outcomes and individuality and personalizing medicine, we need a tool set that can encompass all those different elements that goes beyond just the basic tools that we would think about ordinarily. And I alluded to some of the business aspects, but it's communication, it's tasking, it's reducing the burden on physicians, because what happens in legacy systems, if there's something that needs to be done, just toss it on the doctor's back. They'll take care of it. When there's opportunities to really spread the wealth, be efficient, and really learn from your practice and fine-tune it. So I think really what we do is bring that tool set together, an integrated tool set that can manage all those important things that you need to be successful in your practice, and leverage them and give you insight into your practice. And supercharge your practice to deliver the best outcomes and the best care.
So Doc Health was really started from my own personal pain as a pediatric gastroenterologist at Boston Children's. So I was working as a clinician, but also in our innovation program, and had the benefit of seeing what the world outside of healthcare was using for their tools. And so I got exposed to things like Asana and Trello and Monday. If anyone knows, these are task management tools to really help manage projects. And in some ways, patients are projects. And I was sort of like struck by the fact that, wow, there are these great tools that everyone else has to help get organized and work together as a team. And like here I am, clicking away on like email from 1996 in my EHR in basket. And so that was sort of the inspiration, like, wow, we need better systems to, at the end of the day, I want to provide the best care for my patients. I was, coming home burnt out every day and feeling like I couldn't do as good of a job as I thought my patients deserved, right? And so really that was the inception of just creating a collaborative solution that everyone knew exactly who was responsible for what. That sort of anxiety that I would leave with every Friday, that I was going to forget something and a patient was going to end up in the ER or, calling angry on Monday that we didn't refill their prescription. Like knowing who's responsible for what and ultimately working together as a team and providing, VIP level care for patients is what, I was striving for, difficult to do in an academic medical center. But ultimately, I suspect that everyone here in the audience wants to provide, the best possible care for their patients as efficiently as possible and, get home and see your kids or go to the soccer game or whatever brings you joy. And so for me, it was all about providing that sort of tool set that we can give care teams, broadly speaking, as Allison said earlier, it's all about that caregivers, right? It's not just the physicians, it's the nurses, it's the admins, it's everyone that takes part in that. And we ought to be on the same system instead of, stuck here in one system and email over here and EHR over there. So fundamentally, we're a task management platform integrated with EHR's other, productivity solutions and trying to get everyone on the same page.
Would you say that would you say that Doc Health rather is more or less efficient than a Post-it note strategy?
I'd like to think it's more efficient.
Perfect.
And we have data to prove it, so that's helpful.
Yeah, I mean, so from the business standpoint, I think that the easier we make it to connect your clinical activities to financial success so that, you're getting paid, you're doing the right work, and you're getting paid for the value of that work, technology can, ease some of that. And so we work really hard at Elation to make those processes as much in the background as possible and automated so that, you can focus on your patient. And because if you're not clinically successful, then you're not going to be financially successful in your practice. One thing I'm really excited about that we're doing now is we're revolutionizing our visit note experience. We are bringing AI into it, not just with scribing, but also predictives. And so, if there's a certain set of orders or a certain, group of things that you typically do for a patient with this condition, it's going to, predict those things and bring it to the top for you so that you can easily order those things and just, making that experience much more modernized and robust. And I think that, the goal of all of that is to create success by design. And so that's what technology really should be doing for all of us, is creating success by design instead of, being something that you have to constantly bang your head against all day long. And we live inside the EHR all day long, and that's our primary operating system. And so that's the thing that needs to be able to connect to other solutions with ease, integrate well. You need interoperability so you can get that 360-degree view of your data and information about your patients, and just bringing all of that together in a way that helps you with the sense making of taking care of those patients and all the clinical activities that are associated with that.
I know you started strong on the first question, you mentioning AI right out of the gate. AI is definitely at the peak of its hype cycle right now so far. It might be justified, as Dr. Maha's story alluded to. Are there any technologies that you feel might not be living up to their hype or are a little bit overhyped right now? You can say AI if you want to.
Well, I mean, I don't want to say that AI is overhyped. I think we are still figuring all of that out. But I do want to say that obviously we know that we have to be very careful about it. How we proceed inserting AI into the clinical experience needs to be physician-led. And we need to do that, and I don't hear enough people saying this, in partnership with patients. So we don't want to compromise the patient experience in all of this. We don't want it to feel less personal. We don't want to make them feel like they're disconnected from their doctor. All they're doing is talking to a bot all day or whatever it is. So I think, from a clinical accuracy standpoint and also just from a patient experience standpoint, both the physician and the patient need to be part of that process of figuring out how we're going to really leverage that technology.
Perhaps a little provocative, but I think the electronic health record inbox is overhyped. I think it is, our fallback. It's our default. It has been with all due respect to EHRs, but certainly the one that I was on at an academic medical center was the same email type of system I used in college, 20 plus years ago. So I think, our dependency and the sort of inbox medicine that we practice is really, I'm hopeful, just like with documentation and using AI, that we're going to, in a couple of years' time, see like, wow, I can't believe we actually used email to coordinate care for patients. And, there's a terrible study out of Kaiser Permanente that showed that 58% of the time they dropped the ball on patients with kidney care dysfunction because things just sat in the inbox. And that was, despite my best efforts at Boston Children's Hospital, things sat in my inbox too long. And I think so what our mission is all about, sort of creating that accountability and visibility and sort of process and structure that does not exist in an email. And so every other industry has been transformed by tools like task management, workflow automation. So hopeful that the sort of hype around our dependency on the email in basket is will be dying shortly.
I'm going to go with wearables, potentially. Everyone's got their wearables. You got that patient that comes in and says, "Doctor, I've got my heart rate trends for the past 3 months I want to share with you and just have you analyze it and tell me what I should be doing." So I think that's an area where we're getting more and more data, patient data, that we don't necessarily know exactly what to do with, but we will in the future. So, and different kinds of data. Obviously, it's going to be helpful when there's something wrong, but when we get mountains of data and we don't know exactly how to interpret it, or now we're suddenly responsible for it, it changes the equation for us as well.
And one question that I want to make sure that we tackle while we're up here is kind of a broad question on if you were giving advice to a primary care physician who's thinking about today upgrading the technology in their practice to improve care delivery, what advice would you give to that physician?
Yeah, there's a lot of choices out there, and it's not a decision, obviously, to be taken lightly. But I think it really speaks to what is your vision for your practice? What is your vision for your business? And how is this new software or new product going to fit into that vision and help you achieve your goals? And to that end, it's all about, is it going to help you grow your practice? Is it going to help you scale your practice without adding additional resources? Is it going to help you improve your patient outcomes? Is it going to allow you to tell your customers, whether it be a patient or maybe your employer group, how you're doing? Provide them with the data saying, hey, this is what I'm doing and I'm doing it really well. And I think those are the kinds of things that are really integral to making that decision.
We talk a lot about interoperability, and I think that's sort of like a future state and maybe a magical thing that will never actually happen. But I think I implore folks, because I spent lots of time on the informatics side at Boston Children's, use systems that can integrate with each other, right? So something called open APIs, like how do systems talk to each other? We, trying to sit at the center of clinical and productivity, we connect to systems, and so we now have an integration with Elation and an integration with Hint, and that allows for some really powerful automations that make lives easier, that improve patient care, that make the lives of the clinician and the administrative staff better. And so I guess my advice would be don't shortcut or take the sort of cheaper route to find a solution that maybe doesn't have accessibility, open APIs, integration opportunities, because it opens up an entire new world of possibilities of automating workflows and making your life more efficient, giving you access to data and things that you might otherwise not have if you're using an antiquated system.
Yeah, I couldn't have said it better than the two of you. And EHRs being overhyped notwithstanding, it is really painful. I think we underestimate how painful it will be when we have to change from one EHR to another. And so, setting your vision for your practice, do you plan to scale? You want an EHR to grow with you that is going to be able to handle your future vision for your practice, that's going to be able to integrate with other solutions so that you can customize your digital ecosystem to the needs of your practice and your patient population. And so, the tendency sometimes is to go with, what's cheapest and easier. But you really need to play the long game there, because you don't go into practice for a couple of years. That's something that you really commit to. And so thinking about what that long game is and what your vision for your practice is and planning to that with the end in mind, I think is the goal.
I'm curious, does anyone up here have any maybe technology sleeper picks or tech that they have their eye on that they think shows a lot of promise going forward that maybe might not be getting the attention it deserves in the media or from clinicians, that has the potential to really be a game changer?
Yes. So I am a big advocate for, I think that we have developed EHRs to be very encounter-centric, and I think that needs to go away. Not that we don't want to keep documentation of those encounters, but I think that all needs to feed up into what we need to build our EHRs around, which is comprehensive care planning. And so, this is something that would give me a comprehensive view of all of my patients' issues, what the goals are for treatment, what are the steps that I'm going to take, what are the steps that my team is going to take, what are the steps that the patient's going to take, something that will translate into a patient-facing version so the patient knows in between visits what they're supposed to do to take care of their health. All of those things are part of this comprehensive care plan that also would integrate, ideally, with other members of the healthcare system who are also involved in the care of my patient. And so that's a big vision, but there is a company that's doing something like that. So this comprehensive care plan also has task management, and so it really helps you with communication and following, like, what needs to be done, has it been done, who is responsible for doing it, did it get done on time, did we get the results back, and so the company that I'm thinking of is called Caroline. And really excited. It was originally developed in the inpatient setting, but now it has been moved over into the outpatient setting. And I'm really excited about the things that Caroline is doing, because it really is that comprehensive care plan that will really help you move your patient towards their best health. And I think that's what we need to build our EHRs around, that concept.
When you go through that checklist and that workflow of did we get the results, did we follow up, it sounds so easy. I can only imagine how much of a joy that is to actually build, though. I'm sure it's fun. Anyone else, any technologies that you have your eye on that might be getting a little underweighted?
This is just a plug for really looking at the consumer tools that are out there that have now become HIPAA compliant. So I'd like to think of our tool as a consumer tool built for healthcare. And so there's such a lack of design typically and user experience and the sort of beautiful, engaging experiences that we are used to on our consumer applications. And so, we're using tools and interacting with tools like this one called Typeform. It's just a beautiful form tool. But they sign BAAs, they're HIPAA compliant. We can pull all the data from that and launch workflows in Dock. And so there are lots of really great tools out there that we're helping sort of, organizations cobble together these great best-of-breed experiences for their customers, because ultimately our consumers, our patients, are expecting really beautiful, elegant experiences, and that's always been the disconnect between, healthcare as we know it and the sort of consumer world. And so, just a plug for looking at consumer tools that are now HIPAA compliant.
Are you trying to tell me that doctors and patients are people too?
Jason, this is the easiest question of the day. Clearly the answer is full health here. And just to tell you a little bit more, about the sort of cutting edge things that we're trying to do to get you back to the bedside. When tech was introduced, it was supposed to improve our lives, and we found that it did the opposite in many ways, that we were spending time charting and doing things at home. So how can tech come back and improve your lives, get you back to the bedside of the patient, spending quality time with them. It's things like automations, where it's something that a lab value comes in. Ordinarily, you'd have to check it in your email. It triggers an appointment, gets the patient into your office. Care journeys. We want to embed our DNA into the way we take care of patients. We do it on a patient-by-patient basis, but it's very prescriptive about the education, about the surveillance, their disease surveillance. How do we put that together in a way where we can prescribe a care journey and see how our patient is doing and not be surprised 3 months later when their hemoglobin A1C has gone up? And then the last for me is we all can look at an individual patient when we're in their chart and understand everything about them, but we never think about our entire panels or groups of patients, high-risk patients, or those just with diabetes, or those with multiple medical conditions or taking medication. So taking a step back and being able to really analyze your patient panels in a way that you haven't really looked at before, I think is really exciting.
I completely agree, and I think that might also be a fantastic note to end it on, because I want to open up enough time for the audience to ask any questions of the panel guests while we have them up here. Any questions from the audience? Do we have one? Where am I looking? Right in the back.
Hi, I've been doing DPCs since 2016, and prior to that was really active in doing kind of what you were talking about with population health and looking, okay, just for simplicity, my diabetics who have a hemoglobin A1C above 9 who haven't come back, right? So you could Google it or whatever and get that list. One of the things I've noticed, especially in direct primary care, is we got so sick of that stuff that we just don't even want to look anymore because it was punitive. Have you seen any trends in the tech that allow you to really look at your population a little bit better? It's very simple to look at a patient in front of you and tell them the things you want to do, but sometimes it can be hard to say, okay, of my 500 patients, who hasn't come back and followed up? Like, what's the list of 10 people who, like, I told them to do that, but they didn't come back? And then you can designate that to somebody in your staff to call them and get their sorry rear ends back in your office. So you can draw their blood again and talk to them again and kind of follow up. I think that, tech gives you that opportunity where we used to hire high school students to pull charts off the shelf and open them up. We don't need to do that anymore, but I also think we're not doing it with our computers the way we really could. And I didn't know if you had seen any trends in terms of doing population health in a constructive rather than punitive way.
Yeah, I think if I can address that, I think this is the exciting thing for us, right? This is how we can leverage tech to make us better and take better care of our patients. And it's something that's wasn't traditionally part of a fee-for-service practice. We were practicing reactive care. We waited for our patient to come back. If they were on antihypertensives and they didn't come back in 3 months, you lost them until they came back and had a stroke or something bad happened to them. So it's a way really to rein things in, to have visibility into every kind of patient, and to set the parameters yourself. You can decide whether it's 3 months or, this whole notion of like, I've got a primary care physician, but I've never seen them. I hear that all the time. Why is that? Because we don't really have insight into who's come in. Now we would, and now we can get them in and start doing proactive care instead of reactive care.
Yeah, so Elation does this, and if you haven't seen it, stop by our booth and we'll be happy to show you. But I'm envisioning a world where we actually can use predictive analytics to identify those patients who are at rising risk. They're on a path to catastrophe, so we can really zoom in on those folks and keep them out of trouble, even if they've been coming in, but we just don't necessarily recognize that that's what's happening to them. This idea of just risk stratifying our population, understanding which of our patients need more of our attention than others, and then having those tools available so that you can identify who's lost to follow-up or who is in need of, a particular service, or who needs a different kind of intervention. So there's lots of things that we can do with those population health tools just by being able to customize the list that we pull and looking for those gaps that we need to step into. But in my ideal future, we're putting even more technology. I mean, the technology exists today. We're just not. Healthcare just lags so badly when it comes to, we're modernizing and innovating on our care delivery models, but the technology is just not keeping up.
Perfect. Is there one more question from the audience?
So to your point, Sarah, about lagging behind, I sometimes say that if I could fix anything in medicine, I'd like to eradicate the facts. So the amount of time that we spend calling and following up on faxes that are lost, and the systems say, oh, the fax machine that's published that number on the website, that's wrong. So you need to actually fax it to this place. So I'm interested in anyone who's figuring out how to eradicate faxing as an aspect of practicing medicine in 2023 and going forward. Thank you.
Yes, amen. Yeah, I think we could all agree. I'll just, a little anecdote. So we try to bridge the gap that exists between, how we'd like medicine to be in the future and the reality of we're still using fax machines. So we do a lot of integrations with e-fax solutions, and we'll automate those things so that they, a fax would come in instead of a paper, form that you could barely read because it's, the toner is out. It comes in as a PDF. It becomes a task automatically assigned to the right team or put into the right list, so to speak. So there are ways to, automate a lot of that to clean it up, to make it more efficient, to make it more modern. But yeah, we're not getting rid of the fax anytime soon, unfortunately. But I will carry the flag with you as we try and eliminate the fax.
We do have the ability to direct message so that you bypass the fax, and it just is an electronic message like an HL7 or whatever that goes from one place to the next. So there's the ability to transfer health information that way. It's just that, the healthcare industry, we all have to do it, or else we're stuck faxing.
Looks like we have one more bonus question in the back here. Let's hear it.
Thanks. I'm wondering if I'm wrong in thinking that computers should be able to help us make decisions about diagnosis and treatment, and I haven't heard anything about AI-aided decision-making yet, and I'm wondering if that's on your radar.
Yeah, I think that's true. As Dr. Maha was saying, we don't want to replace the physician. And we need to be very thoughtful about how we proceed with this. But even to the extent that we can have AI collect the relevant information and help make some suggestions to us, or make some use algorithms that, we have good algorithms out there for when to order an MRI, or when to be concerned that a headache is a tumor. So all that stuff exists, and we can definitely use AI to, help us with our clinical decision making. But to Dr. Maha's point, it shouldn't replace the clinician.
I think there are some great clinical decision support tools out there. I think, I see the low-hanging fruit here as the administrative decision support tools. It's all the sort of generative AI capabilities are in reducing the toil of the administrative work, whether it's sending emails, it's sending patient reminders, it's knowing the sort of administrative tasks that are part of a clinical journey, right? So it's, you prescribe something or you place an order or an event that triggers all the sort of administrative stuff, and then I think that's where the low-hanging fruit is. I think the clinical decision support stuff is going to come and take time, and I see it as additive and augmentative, not replacing us, hopefully.
Yeah, there's a lot of studies that say that when something is published that should change our practice, it takes 10 to 20 years to get into clinical practice, right? How many of us are keeping up to date on every bit of literature that impacts our patients? It's impossible. So why wouldn't we leverage something that's doing that and giving us feedback and letting us ultimately make the decision, but giving us the tools to make the decision? I think that's the future, and that's what we want. Because we may know something else, like the person doesn't have a foot, and that's why AI missed it, because we know that, we can see it. But it might also bring up something that on a day we're not bringing our best stuff to work that day, it picks up something, and who wouldn't want that? It's like the good nurse who picks up something and lets you know and saves your cookies. Why not have something like that as well?
I think that's a great note to end it on. We're at time, but our panelists will be running around the show. Make sure to hound them with the remaining questions. And thank you again to Hint for creating a space to have these conversations up here. Really appreciate it.